Hi everybody, today we're going to be talking about the effects of opioids on the brain, specifically fentanyl. This presentation was put together by myself, Jesse, Michaela, Busayo, Jennifer, and Yusuf. So first, what are opioids? It's a class of medications prescribed by doctors to patients in severe and persistent pain, even used acutely, like say after surgery. Opioids can be derived naturally from the poppy plant or made in labs. And some examples of these are fentanyl, morphine, heroin, hydrocodone, and oxycodone. And I want to point this out that fentanyl is a very dangerous opioid just based on its potency, and it can be referred to as several different names, including dance fever, friend, jackpot, etc. When opioids are used beyond their intended reasons, it is considered as illegal or opioid abuse. And there are several ways to do this, either obtaining from illegal sources, forging prescriptions, using more than prescribed, injecting medications intended to be used by mouth, or stealing opioids from a pharmacy or people's medication cabinet. Looking at our opioid epidemic, the U.S. overdose epidemic affects people of every age, sex, race, ethnicity, and geographic location. It does not discriminate. And according to the CDC, synthetic opioids like fentanyl are the primary driver of overdose deaths in the U.S. We saw over a 50% increase in overdose deaths, including synthetic opioids, primarily fentanyl, from 2021 to 2022. And it is the leading cause of these deaths, involved in over 88% of them. So how do these medications affect the brain? Prolonged opioid use alters the brain's reward system, leading to cravings and drug-seeking behavior, which can result in addiction. It can also affect cognitive functions like memory, decision-making, and learning, which is why long-term use often leads to cognitive decline. And lastly, it affects our brainstem, which controls breathing. High doses of opioids can negatively impact breathing, leading to respiratory depression, and this is one of the primary causes of overdose deaths. So, how can you help with opioid overdoses? First, recognizing the signs and symptoms, which we'll get into next. Call for help by dialing 911, administer naloxone or Narcan, perform rescue breathing if needed, placing the person in the recovery position, monitor until help arrives, and avoid using opioids. And you can also use fentanyl test strips in the drug that they took to see if it's present. So, talking about the signs and symptoms of an overdose. Seeing if they're unresponsive, asking if they're okay, trying to wake them up. They might also be unable to wake up. Looking at their breathing. Is it slow, shallow? Is it stopped altogether? Any gurgling noises? Looking at their pupils. You might check for small, constricted, or pinpoint pupils. And lastly, looking at their skin. Is it bluish, cold, and clammy? So, when administering Narcan, you want to lay the patient on their back if they're not there already and check for responsiveness. Then tilt the patient's head back, insert Narcan into one nostril and administer dose by pushing plunger in. Roll the patient on their side, call 911, and then you can actually repeat steps 1 through 4 until responsive or medical assistance arrives. Lastly, you can purchase fentanyl test strips. This is a way you can test for fentanyl in drugs. You want to place about 10 milliliters of the drug into a cup dissolved into water, dip the test strip in for about 15 seconds, and then lay it flat on a surface for about 2 to 5 minutes, and then you can read the results, which can be found on this right side of the screen. Next, we have a short little clip kind of showing how you might come across somebody who could be overdosing on opioids and what to do.
Oh my God, Yusuf! Yusuf, are you okay? Yusuf, can you hear me? Oh my God, he's not breathing. I have some in my back. Okay. Okay. Yusuf, I'm just gonna give you some Narcan, okay? Yusuf, are you okay? Oh my God, I need you to sit up. Oh my God, you just passed out on the staircase. Alright, if you want to give a dose of Narcan, you have to just put it in the nose of the patient and then you spray the plunger. I hope you feel good, Yusuf.
Thank you for listening to our presentation today, and we hope that you learned a little bit more about opioids, specifically fentanyl, and how you can help somebody who might be experiencing an overdose.